Next topic is walnuts in diabetes. For this presentation, Dr. S.K. Gautam from GSVM Kanpur is going to present this talk. Dr. S.K. Gautam is a professor of medicine at Kanpur, and so, sir, you can take on the stage.
Thank you, Chairperson, for the kind introduction. I would like to thank the organizer for giving me opportunity to speak in front of this August gatherings. Especially thankful to Anupam sir and Dr. Ashok for inviting me here. So, since yesterday we are talking about the different OHAs, metformin, sulfonylureas, GLP-1, and newer insulins. So, I'm taking you slight away from the routine. I'm talking about the diet. I will be speaking on the nuts. So, inclusion of nuts in your diet, how it will helpful. Let's see what the researchers said. So it's a diabetes global emergencies, and there are currently 537 million people of working age with diagnosed or undiagnosed in 2021. And if current trends continue, the 783.2 million adults will have the diabetes in 2045. If we talk about the diabetes in India, and India ranks still number 2 in that list of countries with the largest number of adults with diabetes in 2021, and is anticipated to remain so in 2030 as well as in 2045. So now come to the nuts classification first. So nuts are the basically nutrient dense food with a complex matrix. These provide the unsaturated fatty acids, then plant proteins, then bioactive compounds, then phenolic compounds, then non-sodium minerals like selenium, zinc, magnesium that play a role in decreasing the incidence of diabetes. Later on, we'll see in the further slides how will it decrease the incidence of diabetes and other things. If you talk about the classification of the nuts, nuts are basically, these are the nuts included, these are the almonds, Brazil nuts, cashew nuts, hazelnuts, macadamias, pecans, pine nuts, pistachio, and walnuts. Peanuts, peanuts basically is not a tree nuts, but peanuts here are technically a legume, but sharing the similar nutritional and culinary profile to tree nuts, hence their inclusion in the nuts classification here. So nuts are a very good source of nutrients. That's why it is called the superfoods, because they have a good source of nutrients as well as the packed with the numerous vitamins, minerals, calcium, proteins, fibers, and unsaturated fatty acids in the form of TUFA and MUFA. It is advisable to have a handful of nuts every day for staying healthy. But if you are diabetic, then consuming all nuts might not be a good idea for you. So it is essential to eat mindful so their blood sugar level remain in control. Some nuts are better than the others for people suffering from diabetes. So there are 5 best nuts to include in your diet for a healthy life. These are the macronutrients and micronutrients composition of natural nuts, almonds, walnut, hazelnut, pistachio, macadamias. So it's a busy slide just to highlight certain things about the almonds. Almonds are very rich in the calcium and magnesium, phosphorus. And if you talk about the walnuts, so walnuts are very, very rich in polyunsaturated fatty acid as compared to the other nuts if you see. So lifestyle change such as those related to the nutrients underpin a general approach to diabetes risk minimization and the management. So current diabetic guidelines recommend dietary patterns as a Mediterranean and a vegetarian pattern which encourage the consumption of nuts. So the nuts are nutrient dense food with a complex matrix providing the unsaturated fatty acids, plant proteins, non-sodium minerals, phenolic acid and other bioactive compounds. here are the some clinical trials, long-term clinical trials shows the effect of the consumption of long-term nut in diabetes. If we see, the incidences are decreased in a non-diabetic population also. If a person consume nut, the incidence of developing diabetes decreased. And if it see in the diabetic patient, that decreases the consumption of nut, decreases the fasting insulin, fasting glucose, then HbA1c, then HOMA-IR. And in a patient participated with or without diabetes, that also fasting insulin, HbA1c, and HOMA-IR are decreased. Here the potential role of nuts in type 2 diabetes for prevention and the management. Prevention as well as management. So macronutrients, micronutrients, and bioactive compounds. So if you see the macronutrients like carbohydrate-related fibers and unsaturated fats related MUFA and PUFA, they regulate the postprandial glycemia, they increases the satiety, and they incretin modulation will be there. If you see the vitamins E, most of the nuts are very rich in vitamins E, minerals, magnesium, selenium, zinc. They have the anti-inflammatory and antioxidant properties. Apart from this, they regulate the insulin resistance also and the carbohydrate metabolism. Other bioactive compounds like flavonoids, phenolic acids, apart from they are having the anti-inflammatory and antioxidant property, they protect the beta cell against the glucose toxicity. So ultimately the body weight management, regulation of the postprandial glucose, improving the insulin secretions, and decreases the insulin resistance that ultimately lead to the prevention and the management of the diabetes. Related to the macronutrient composition of the nuts, low glycemic index, the fiber, the nut contain low amount of available carbohydrates, meaning they do not contribute significantly in the postprandial glycemia. However, when nuts are added to the food with a high available carbohydrate, what happened? They demonstrate a dose-dependent reduction in the glycemic index, and this is thought to be their high fat and protein contents, and which are a source of additional energy when added to the food with a highly available carbohydrate. So increase in the energy density fat, high fat and protein, and high fiber contain food that decreases the gastric emptying, and as the dose of nut is increased and the rate of gastric emptying is decreased, and that may lead to increased feeling of satiety, and that ultimately decrease the PPG. So nuts are very rich fibers content also. So what fibers will do? Soluble fibers has been shown to increase the viscosity of the intestinal content and slow down the absorption of the nutrient in the GI tract. So consumption of food containing soluble fibers have been shown to lower the PPG, and fiber has also been resistant to digestion by the enzymes. So in the small intestine, as a result, so susceptible to fermentation by bacteria in the colon, and which lead to production of the short chain fatty acid. This short chain fatty acid has been shown to reduce the hepatic glucose output and stimulate the secretions of incretin hormones GLP-1, and that GLP-1 as well as other incretin like GIP promotes the proliferation of the beta cells and their secretion of the insulin, which favors the maintenance of the blood glucose levels. So as such, the consumption of the nut may slow the absorption of the carbohydrate, stimulate the incretin secretion, and which can positively impact on the glucose homeostasis. Furthermore, repeated decrease in the postprandial glucose uptake, such as that observed that nut consumption has been hypothesized to contribute in decrease in the inflammation, oxidative process, and mitochondrial toxicity, further contributing in the reduction of the risk of developing diabetes. Now coming to the unsaturated versus saturated fatty acids. So nuts are very rich in high content of unsaturated fat content like PUFA and MUFA. So substitution of the carbohydrate or saturated fat with the unsaturated fatty acid may be responsible for improvement in the insulin sensitivity. So replacement of the carbohydrate or short chain fatty acid with PUFA and MUFA, improve the markers of the glycemic control, including the HbA1c and HOMA-IR. It should be noted that the evidence involving in the study of PUFA tended to include in the combination of these fatty acids like EPA, DHA, and ALA. So, unsaturated fatty acid from nuts may stimulate the secretion of GLP-1, which stimulate the secretion of the insulin from the beta cells, and that promote the proliferation of the beta cell and therefore improve the beta cell efficacy. About the vitamins and minerals, nuts are a very rich source of the vitamin E, selenium, zinc, magnesium. So nut, depending on the types, containing relatively high amount of vitamin E, selenium, zinc, and other nutrients, they are found in relatively high amount in nuts that may be beneficial. Magnesium also, we all know that magnesium has been associated with beneficial effect on the glycemic control. Imbalance in the magnesium status, especially hypomagnesemia, that lead to inhibit the glucose transport type 4 translocation, increase the insulin resistance. So, when considering individual with type 2 diabetes, oral magnesium supplementation equivalent to just over half cup of nuts significantly improve the glycemic control indicator like HbA1c, C-peptide level, HOMA-IR, and the HOMA-B, etc. Phenolic and other biocompounds. So nuts are composed of the matrix of important bioactive compounds. Includes the flavonoids, phenolic acid, stabilins, ligands, and other polyphenols. So polyphenols may improve the HbA1c and the insulin resistance, in addition to having the anti-inflammatory and antioxidant properties such as superoxide dismutase activity and radical scavenging activity. So in these ways, various polyphenols may lower the risk of developing diabetes and its complications. So polyphenols in the nuts may also be protective against the diabetes by modifying the gut microbiota. Yet consumption of the approximately 50 gram per day of the nuts could provide the polyphenol dose observed with the reduced incidences of type 2 diabetes. Now related to the body weight and adiposity. So we all know that approximately 60 to 90% of diabetes has been attributed to the obesity or weight gain. So however, elevated weight gain can increase the risk of developing diabetic complication and comorbidities. So while nuts appear to be relatively high in calculated total calories and fat basically unsaturated, so their consumption has not been associated with the weight gain nor an increased risk of developing weight, increasing that overweight or obesity. So adiposity factors like BMI, waist circumference has been shown to play a role in mediating the association between the nut consumption and the marker of the glycemic control like fasting blood glucose, plasma insulin, HOMA-IR, suggesting a potential mechanism for prevention of the diabetes risk. Now, a few words about the gut microbiota. So, within the complex nutrient matrix of the nut, some of the components like fiber and polyphenols, they are resistant to digest. They are digest very late, so can reach the colon intact and interact with the gut microbiota, gut microbial population, changing its composition and functions. So the microbial colonic fermentation of undigested fiber and other nutrients from the nut that lead to the production of short chain fatty acids and with demonstrated positive effect on the gut microbial homeostasis and may serve as the prebiotics. Nuts are also rich in polyphenols and undigested polyphenols are thought to exert a prebiotic effect by stimulating the growth and activity of some bacteria like bifidobacteria in the digestive tract. So, increased level of fecal bifidobacteria has been associated with improved glucose tolerance and diminish the inflammation markers like interleukins and TNF-alpha. Almond-based diet should promote the growth of short-chain fatty acid producing bacteria in the gut. Walnut also rich in polyphenols and elagitannins, which are metabolized by the intestinal bacteria into urolithins. So walnut supplementation, even if a short term, can impact the metabolism of elagitannins to the urolithins via gut microbiota by increasing the production of the short chain fatty acids. And this may impact the risk of diabetes, as it has been observed that proportionate can reduce the serum cholesterol, improve the insulin sensitivity, and as well as promote the satiety also. Few word about the microRNA. So nuts may modulate the expression of the genes related to the glucose metabolism. So through the mediatory effect of the nutrient on microRNA. MicroRNA are basically a small non-coding RNA with 20 to 25 nucleotides that post-transcriptionally and negatively regulate the gene expression. So 8 weeks following a PUFA-enriched diet, normocaloric diet, that a patient take daily of 30 grams of almonds and walnuts, and resulted in a significant modification in the several common microRNAs. So change in the circulating PUFA were associated with change in the plasma microRNA. Change in the microRNA were associated with a change in the plasma C-reactive protein, plasma fasting triglyceride, and aponectins. So a study, they have 7 human circulating mRNA were selected for analysis in epidermis study, and that are considered widely related to the glucose metabolism, insulin resistance status, pre-diabetic status, and biomarkers of the type 2. So mRNA expression beta data shows that the 7 mRNA studied after pistachio intervention, circulating mRNA 192 and 357 expression were significantly lower than in the control phase. So further more changes in the circulating mRNA were positively associated with the plasma glucose, insulin, HOMA-IR, indicating that increase in these mRNA levels mirror and the increase in the insulin resistance. So in the last few slides about the walnut nutrition. If you talk about the walnut, the slide here compared the walnut with 5 other nuts, pistachio, peanuts, almonds, pecans, and walnuts. So the maximum omega-3 fatty acid were observed in the walnuts, the only nut with the excellent source of omega-3 fatty acid like ALA. So walnuts are unique as they are the only nut significantly high in omega-3. One serving of walnut exceeds the daily recommendation intake of ALA for both men and women. ALA may be effective in reducing the risk of cardiovascular diseases such as marine drive omega-3, EPA, and DHA. It's a good source of other micronutrients, magnesium, vitamin B6, copper, manganese, and a variety of antioxidants like polyphenols, gamma tocopherol, and contain melatonin also, which improve the sleep cycle. So just to support 1 or 2 studies there published in the Journal of Nutrition. In this, their regular consumption of nut is associated with a lower risk of cardiovascular disease in the women with type 2 diabetes. And they concluded the increase in the nut consumption was significantly associated with a more favorable plasma lipid profile, including lower LDL cholesterol, non-HDL cholesterol, total cholesterol, and aponectin B concentration. In another study by Jansky and David, the possible benefits of nut in type 2 diabetes, they concluded the evidence suggested that the nut consumption includes peanuts, protect against not only the chronic CHD, but also against the diabetes and CHD associated with the diabetes and other metabolic syndrome. So incorporating into the overall diet may provide nutritional benefit on more than one level, specifically in disease such as diabetes. So just to summarize my talk, higher nut consumption may be beneficial effect on the diabetes prevention and the management. In particularly some, but not all, large cohort studies have been found that higher consumption of total nuts, walnuts, peanuts were significantly associated with a lower risk of type 2 diabetes. However, inclusion of the nut in the diet of an individual may have a beneficial effect on the glycemic control and lower the risk of cardiovascular disease, mortality in type 2 diabetes. In individuals with type 2 diabetes, specifically, acute studies have demonstrated reduction in the PPG, and long-term trials have indicated modest positive effect on the blood glucose control, as shown by the reduction in the HbA1c and the fasting glucose. So, future researches are needed to better elucidate the impact of the nuts on the prevention and the management of diabetes. Thank you so much for the patient hearing.
Thank you, Dr. Gautam. It's a different topic from run-of-the-mill kind of talks which we have been listening in the conferences, and not much attention has been paid into the nutritional aspect or exercise aspects in the discussions. Nuts are new kids on the block in the nutritional therapy, but again the question remains how much, and there's not much data, large studies are not there. Probably a handful of that, people will say an ounce of that. 30 grams, what you suggest? Per
Yes,
day?
you're absolutely right. The not more data is available, but what the guidelines says that the around 30 to 42 grams of nuts daily consumption. In fact, the combination of the nuts you have to include in your diet. In the daily consumption, it will be not more than 40 grams per day.
Yeah, that limit has to be because they are rich in calories also. And 100 grams of mixed nuts will be somewhere carrying 600
Obviously,
plus
so
calories.
that's why
So
I
mindful of
recommend
that.
the combination of the nuts
Yes.
to be included, at least three types, minimum three types of nut included in the 40 grams.
The
per
second
day.
thing, be careful, whatever pistachios we are getting, the roasted pistachios over
Yeah.
there, laced with salt. So excess of that will not be good. Another aspect is that these nuts are very rich in potassium also. So if the person is having nephropathy or advanced renal disease or on ACE, ARBs and MRSA inhibitors,
Obviously,
there is
that,
a risk of hyperkalemia.
that should
So be careful prescribing or suggesting those individuals where they have got advanced nephropathy. Be cautious, monitoring will be required.
Before
And may not be prescribed at all in the patients of renal failure.
Obviously,
unless
sir,
they are-
that should be
unless
taken
they are
care of.
replacement therapy.
And while prescribing the nuts, it should be clear that salted nuts should be avoided, and some flavored nuts are also available that are higher in the carbohydrate contents, chocolate nuts and other nuts. That should also be avoided because the nuts are already having a lot of calories, and if a patient is taking the flavored nut or chocolate nuts, that increases the calories further. That will not help. So that take care of mind while prescribing the nuts.
Another question from the chair or audience?
So, any opinion on makhane, the fox nuts that are like being very much used these days?
Makhana can be used, each and every nuts can be used, but not in the too much amount, because all nuts, if you see in the, as a whole, they have a rich in the fiber, they have a rich in the minerals, they have a rich in the bioactive compounds, but the amount or percentage is somewhat varies from nut to nut. So patient can take makhana also, but that's why I said the patient has to include the at least 5 type of nut in your diet. He can include the makhana and other nuts, but the total amount should not go beyond the 42 grams per day.
What should the time gap between the nuts and taking food?
It's not mentioned sir, anywhere, so nuts are taken before the foods or after the foods. Nuts are basically used as a snacks. So that's why obviously we use before the meals also. So because the diabetic patient in between, they have having the craving of the foods. So in that case, including the other type of snacks, it is preferred to include the nuts as a snacks in the meals.
Can you please give the mic?
Fruits and salad,
So-
all should be taken before food, half an hour before. That's
Yes, sir.
all. My question is, when they say that you make a sprout, like we are consuming in the morning, if we sprout these nuts, are they more beneficial than the dry one?
Yes,
Because
sir.
it is seen that peanut is kept overnight. The efficacy of peanut is at par with the almonds. It is a poor man's almond. So what is your comment about walnut, peanut, the almond of a sprout or otherwise?
Yes, soaking nuts are very good question, sir. Soaking nut, that's why we call it activated nuts. So many people, they in the morning, in the evening hours, they put almonds in the water, and in the morning they'll take. So what happened if you give hydration like seeds? If you give a water, it germinates. So on germination, what happened? The phytic acid will decrease, will deactivate. So phytic acid, what happened? The phytic acid, what will it do? It have a interference in the absorption of the minerals and some iron, calcium also. But in the other hand, so if you see, phytic acid have a good antioxidant also and having the anti-cancerous activity. So I do not recommend to activated nut to take. So we do not soak. It's avoided to take the soaked nuts. Yes, sir.
None other nuts are soaked.
Yes, sir.
And before prescribing nuts, you should also know the prices of these nuts.
Obviously.
Secondly, nowadays it is nuts along with the various seeds that is being said to be more effective. A combination of the various kinds of seeds and some nuts, not a handful of nuts.
Very good, sir. Very good question, sir. That's why I have included the peanuts also. Peanuts are not a tree nuts, but it's had all the bioactive compounds in the nuts. So it's depend on the cost. You can prescribe the peanuts, you can prescribe the almonds, you can prescribe the walnut, you can prescribe the pistachios.
So,
L is silent. It is called
so
almond.
let us finish this thing, and thank you, Dr. Gautam, for sensitizing the house regarding the use of these nuts, especially for diabetic patient. Thank you.
Thank you, sir. Thank you so much.